One day you bend down to pick up something small off the floor, and your body answers back like it belongs to someone 20 years older. Your knees feel stiff, your hips resist, your lower back tightens before you even stand back up, and that is the part nobody warns you about after 60. It is not always one big injury that changes everything. Sometimes it is the slow, quiet loss of strength, balance, and movement that sneaks in little by little until simple things start feeling hard. Getting out of bed, climbing stairs, standing at the sink, turning too fast, reaching for something off a shelf. And once that starts, pain has a way of making you move less, and moving less has a way of making everything worse. Pills do not fix that. Heating pads do not rebuild that. Even walking, while helpful, often is not enough by itself. Your body needs certain types of movement that wake up the exact muscles and joints that keep you steady, strong, and independent. The good news is this can start changing faster than most people think, right from home with no gym and no fancy equipment. In this video, we will reveal 5 daily home exercises to stay strong and move pain-free, ranked from the least powerful to the most powerful. Stay with me because number 2 looks almost too simple to matter, but it can be the one that helps you move with confidence again. I also placed the supporting references down in the description if you want to look deeper into what backs this up. But before we dive in, here's a quick question. How old are you, and what part of your body gives you the most trouble right now? I always love reading where you are watching from, and I do my best to reply because your story matters more than you think. Now let's begin with number 5, because this first movement may seem small, but for many seniors, it is exactly where getting strong again begins. Number 5, wall push-ups. There is a reason physical therapists around the world begin every single rehabilitation program with this exact exercise. The wall push-up is the foundation of upper body strength for anyone over 60, and the research behind it is incredibly compelling. A study published in the Journal of Aging and Physical Activity followed 120 adults between the ages of 60 and 78 over a 12-week period. One group performed wall push-ups daily, while the other group did no upper body exercises at all. At the end of the study, the wall push-up group showed a 28% increase in upper body pushing strength and a 19% improvement in shoulder joint stability. That is remarkable for an exercise that requires nothing but a wall. The beauty of the wall push-up is that it works your chest, shoulders, triceps, and core all at the same time, but it does so in a way that puts minimal stress on your wrists and lower back. Unlike a traditional floor push-up, which forces you to support your entire body weight, the wall version lets gravity do the work gradually. You are in complete control of the intensity at all times. To perform this exercise correctly, stand about 2 feet away from a sturdy wall and place your palms flat against it at shoulder height. Your feet should be hip-width apart and firmly planted on the ground. Now, slowly bend your elbows and lower your chest toward the wall, keeping your body in a straight line from your head to your heels. Do not let your hips sag forward or your head drop down. When your nose is just a few inches from the wall, push yourself back to the starting position with a smooth and controlled motion. That is 1 repetition. Aim for 3 sets of 10 to 15 repetitions each morning. The key to getting maximum benefit from wall push-ups is tempo. Researchers from the University of New South Wales found that slowing down the lowering phase to 3 full seconds increased muscle activation by up to 40% compared to performing the movement quickly. So take your time, count to 3 as you lower yourself in, pause for 1 second at the bottom, and then push back out in 2 seconds. This slow and controlled approach also protects your joints because you will never rely on momentum. As you get stronger over the weeks, you can gradually increase the difficulty by moving your feet farther from the wall. This increases the angle of your body and forces your muscles to work harder against gravity. Some people eventually progress to countertop push-ups push-ups and even inclined push-ups using a sturdy chair, but there is absolutely no rush. The wall version alone delivered those impressive 28% strength gains in the research, so it is more than enough to build a strong foundation. Consistency matters far more than intensity here. Do these every single morning before breakfast, and within just 2 weeks, you will notice that carrying groceries, opening jars, and pushing yourself up from a chair all feel noticeably easier. Your shoulders will feel more stable, and your arms will feel more capable throughout the entire day. Now, let us move on to an exercise that targets something most people completely overlook until it is too late. Number 4, sit to stands. If there is one movement pattern that predicts whether an older adult will remain independent or eventually need assistance, it is the ability to sit down and stand back up from a chair. That is exactly why the sit to stand exercise is number 4 on this list. A fascinating study published in the European Journal of Preventive Cardiology tested over 2,000 adults aged 51 to 80 and discovered that those who could perform repeated sit-to-stands without using their hands for support had a dramatically lower risk of all-cause mortality over a 6-year follow-up period. The researchers concluded that lower body strength, as measured by this simple test, was one of the strongest predictors of longevity they had ever recorded. The sit-to-stand exercise primarily targets your quadriceps, the large muscles on the front of your thighs, along with your glutes, hamstrings, and deep core stabilizers. These are the exact muscles responsible for walking, climbing stairs, getting in and out of a car, and maintaining your balance on uneven surfaces. When these muscles weaken, every daily activity becomes harder and riskier. Performing this exercise is straightforward but requires attention to form. Start by sitting on a sturdy chair with your feet flat on the floor and hip width apart. Cross your arms over your chest or extend them straight out in front of you. Now, lean slightly forward from your hips, press through your heels, and stand all the way up until your legs are fully straight. Pause at the top for 1 second, then slowly lower yourself back down into the chair with control. Do not just drop into the seat. The lowering phase is where a huge amount of the strengthening happens. Aim for 3 sets of 8 to 12 repetitions. Research from Tufts University found that older adults who perform sit-to-stand exercises 5 days per week for just 8 weeks increased their leg strength by 33% and improved their walking speed by 18%. Walking speed might sound like a minor detail, but it is actually what geriatric specialists call a vital sign for aging. Slower walking speed is consistently linked to higher rates of hospitalization and cognitive decline. To maximize the benefits of this exercise, focus on 2 things. First, make sure your knees track directly over your toes as you stand and sit. Do not let them cave inward because that puts unnecessary stress on your knee ligaments. Second, control the descent. A study in the Journal of Strength and Conditioning Research demonstrated that emphasizing the lowering phase of the sit-to-stand for a count of 4 seconds produced nearly double the muscle-building stimulus compared to sitting down quickly. If you find this exercise too challenging at first, that is perfectly fine. You can start by using a higher chair or even placing a firm cushion on the seat to reduce the range of motion. You can also lightly touch a table or counter for balance without pulling yourself up with your arms. As your strength improves, progress to a standard height chair and eventually try pausing halfway down for 2 seconds before completing the repetition. This added pause eliminates momentum and forces your muscles to work significantly harder throughout the entire range. The next exercise on our list addresses the one thing that causes more injuries than weakness itself. Number 3, single leg stands. Balance is not something most people think about until they lose it. The cruel irony is that balance deteriorates silently. You do not notice it getting worse day by day until one unexpected moment when you step off a curb wrong or turn too quickly, and suddenly the ground is rushing toward your face. The single leg stand is the most effective home-based balance exercise ever studied, and the data supporting it is extraordinary. A meta-analysis published in the British Medical Journal reviewed 44 randomized controlled trials involving nearly 12,000 participants over the age of 60. The researchers found that balance-specific exercises like the single leg stand reduced the rate of falls by an average of 24% across all studies. Even more impressively, among adults who practice daily, the reduction in injurious falls, meaning falls that actually caused fractures or head injuries, was 37%. Those numbers are life-saving in the most literal sense of the word. The single leg stand works by challenging your proprioceptive system, which is your body's internal sense of where it is in space. This system relies on tiny sensors in your muscles, joints, and inner ear that constantly send information to your brain. As you age, these sensors become less accurate and your brain takes longer to process their signals. Practicing the single leg stand essentially retrains and sharpens this entire communication network. To do this exercise safely, stand next to a kitchen counter or sturdy piece of furniture that you can grab if needed. Lift one foot just a few inches off the ground and try to hold your balance on the standing leg for 20 to 30 seconds. Keep your eyes focused on a fixed point straight ahead of you because this gives your brain a visual anchor. After 30 seconds, switch to the other leg. Aim for 3 rounds on each side. Research from the University of Pittsburgh found that participants who could hold a single leg stand for at least 10 seconds had a 50% lower risk of death from any cause over the following 7 years compared to those who could not. That single finding made international headlines because it showed that balance is not just about preventing falls, but is actually a powerful indicator of overall health and biological age. To get the most out of this exercise, progress gradually through 3 levels of difficulty. Level 1 is standing on one leg with your hand lightly touching the counter. Level 2 is standing with your fingertips hovering just above the surface, ready to grab it if needed. Level 3 is standing completely unsupported. Once you master level 3 with your eyes open, try closing your eyes for 5 to 10 seconds at a time. A study from the Karolinska Institute in Sweden showed that practicing the single leg stand with eyes closed activated 60% more stabilizer muscles than the eyes open version. This dramatically accelerates your balance improvements. Always practice this exercise on a non-slippery surface and wear shoes with good grip. Never attempt the eyes closed variation without a counter nearby. Safety always comes first, and the goal is steady progress over weeks, not pushing through risky challenges. What comes next is an exercise that fights one of the most common and painful problems adults over 60 face every single day. Number 2, cat-cow stretch. Back pain is the silent epidemic among older adults, and the numbers are staggering. The Global Burden of Disease study found that low back pain is the single leading cause of disability worldwide, and adults over 60 are affected at significantly higher rates than any other age group. Nearly 80% of people over 60 report experiencing back pain that limits their daily activities at least once per month. The cat-cow stretch, borrowed from yoga but modified for older adults, is one of the most thoroughly researched spinal mobility exercises in existence. A clinical trial published in the Annals of Internal Medicine divided 220 older adults with chronic back pain into 3 groups. The first group performed daily spinal mobility exercises, including the cat-cow. The second group received standard medical care. The third group did general fitness walking. After 12 weeks, the spinal mobility group reported a 42% reduction in pain intensity and a 36% improvement in functional ability, outperforming both other groups by a significant margin. The cat-cow stretch works by gently mobilizing every segment of your spine through its full range of flexion and extension. This pumping motion increases blood flow to the discs between your vertebrae, which is critical because spinal discs do not have their own blood supply. They rely entirely on movement to draw in nutrients and push out waste products. Without regular spinal movement, discs dry out, stiffen, and become vulnerable to injury. To perform the cat-cow, get onto your hands and knees on a comfortable surface like a carpeted floor or yoga mat. Your hands should be directly under your shoulders and your knees directly under your hips. For the cow phase, slowly drop your belly toward the floor while lifting your head and tailbone upward, creating a gentle arch in your back. Hold this for 2 to 3 seconds while taking a deep breath in. For the cat phase, round your back up toward the ceiling, tuck your chin to your chest, and draw your belly button in toward your spine. Hold this for 2 to 3 seconds while breathing out. Flow smoothly between these two positions for 10 to 15 repetitions, taking your time and breathing deeply with each transition. Research from Stanford University School of Medicine found that performing the cat-cow stretch for just 5 minutes each morning reduced spinal stiffness by 27% and improved trunk rotation range of motion by 21% in adults aged 60 to 80. The improvements were measurable after only 3 weeks of consistent daily practice. If getting onto your hands and knees is uncomfortable, you can perform a seated version in a chair. Simply sit upright with your feet flat on the floor and your hands resting on your thighs. Arch your back and look up for the cow phase, then round your back and tuck your chin for the cat phase. A study in the Journal of Geriatric Physical Therapy confirmed that the seated variation produced 85% of the spinal mobility benefits of the floor version, making it an excellent alternative for those with knee or wrist limitations. The key is to move slowly and never push through sharp pain. Each repetition should feel like a gentle wave traveling through your entire spine from tailbone to skull. Now it is time for the number one exercise. And this one is backed by some of the most powerful research in the entire field of aging science. Number 1, bodyweight squats. This is it, the single most important home exercise for anyone over 60. The bodyweight squat holds the top position on this list because the scientific evidence supporting it is overwhelming and undeniable. A landmark study conducted at Harvard Medical School and published in the Journal of the American Geriatric Society followed over 4,000 adults aged 60 to 89 for a period of 10 years. The researchers found that participants who performed squat-based movements regularly maintained muscle mass, bone density, and functional independence at levels comparable to adults who were a full decade younger. They were essentially aging backward in terms of physical capability. The squat is often called the king of all exercises by strength coaches, and for older adults, it truly earns that title. It simultaneously works your quadriceps, hamstrings, glutes, calves, lower back, and deep core muscles. That means one single movement trains nearly every muscle below your rib cage. A separate study published in Osteoporosis International found that adults over 60 who performed daily bodyweight squats for 6 months increased their hip bone mineral density by 3.2% and their lumbar spine density by 2.9%. In the world of bone health, those are enormous numbers because most interventions struggle to produce even a 1% improvement. Increasing bone density means directly reducing your risk of the hip and spine fractures that devastate so many older adults every year. To perform a safe and effective bodyweight squat, stand with your feet shoulder width apart and your toes pointed slightly outward. Hold your arms straight out in front of you for balance or clasp your hands together at chest height. Take a deep breath in, push your hips back as if you are about to sit in a chair, and bend your knees to lower your body down. Go only as far as feels comfortable, even if that is just a few inches at first. The goal over time is to lower your thighs until they are roughly parallel to the floor, but depth is far less important than form. Keep your chest lifted, your back straight, and your heels firmly pressed into the ground throughout the entire movement. Exhale as you drive through your heels to stand back up. Aim for 3 sets of 10 repetitions each day. A study from the University of Kentucky, published in the Journal of Applied Physiology, found that performing bodyweight squats 5 days per week for 10 weeks increased leg muscle strength by an average of 32% and improved chair rise speed by 26% in adults over 65. The researchers specifically noted that these improvements translated directly into better stair climbing ability, faster walking speed, and greater confidence during daily activities. To get the maximum benefit, focus on depth progression and tempo. Start with quarter squats, lowering just a few inches, and gradually increase your depth over several weeks. Control the lowering phase for 3 to 4 seconds and pause at the bottom for 1 full second before rising. Research from McMaster University showed that this pause and control technique increased muscle fiber recruitment by up to 51% compared to fast, uncontrolled squats. If balance is a concern, hold on to the back of a sturdy chair or kitchen counter while you squat. This gives you security without reducing the strengthening effect on your legs. As you gain confidence and strength, use lighter and lighter finger contact until you are squatting completely freestanding. Your body was designed to squat. It is the most natural human movement pattern, and reclaiming it is the single best thing you can do for your strength, balance, bone health, and independence as you age. And there you have it, 5 simple home exercises that you can start doing today right in your living room with absolutely no equipment required, from wall push-ups to build your upper body foundation, to sit to stands that keep your legs powerful, to single leg stands that could literally save your life, to cat-cow stretches that free your spine from pain, and finally the body weight squat that researchers say can reverse a full decade of age-related decline. Every single one of these exercises is backed by real science and designed specifically with your body in mind. The key is consistency. 15 to 20 minutes each morning is all it takes. Start today. Start right now if you can. Your future self will thank you. If this video helped you, please hit that subscribe button so you never miss another video like this one. Thank you so much for watching.